This is Brian Warmers recording a lecture on the integumentary system and providing you an overview of this system. The main learning objectives for this are to discuss the functions of the integumentary system, discuss aspects of the assessment of the integumentary system, and then classify skin lesions. So as an overview, this is the structures of the skin. You should be able to identify the subcutaneous fat, the dermis, the epidermis, hair, nails, and the glands, including sebaceous and sweat. There's some great references here for you to review these, but I am taking the assumption that you know these already. So what does the skin do? The skin is one of our major organs um, of our body, and some of the things that it does is protection. It protects us from temperature changes, it protects us from infection, it protects us from um, injury. So it also provides us homeostasis. And homeostasis is that big fancy word that means that your body likes to maintain a normal, regular tone, whether that is in function or in temperature or in a variety of different things. We already covered this, but it does like to promote temperature regulation. It's also a sensory organ. This is where we have touch and feel from. It does do some vitamin synthesis, most notably vitamin D, which is a very popular thing to study right now, as well as it's a huge component of your psychosocial evaluation. As we look at somebody's body image and what they think of themselves, oftentimes their skin is a major component to that. Do they have any burns, any cuts, any lacerations, any tattoos, any acne? All those things can affect the way that somebody views themselves and sometimes how others view them. So part of the subjective assessment are things such as demographic data. Where do they live? Are they living up in northern Alaska where they might not see a lot of sun? Do they live down in coastal Florida where they're out on the beach all the time? What things will they be exposed to in those demographic divisions? What kind of social economic status do they have? Are they going to be able to provide themselves with basic care of their skin, washing it, cleaning it, drying it thoroughly, medications if needed? And speaking of which, what medications are they currently using? Anything for acne, anything like steroids that can thin the skin, anything that can stain the skin. All those are major considerations. Do they have any allergies? Not just to medications, but anything they might start to come in contact with. Skin tends to be very sensitive to nickels, or people might have allergies to peanuts, and that can cause them to have rashes. So what's their nutritional status? Do they have the resources needed within their body if they have a laceration or a cut? Do they have enough albumin and protein to be able to fix that cut? What's their family and genetic risk? Do they have a family history of skin cancer or hirsutism or any of these other things? Um, and if that's the case, then that generally speaking will put this patient at a higher risk. And also, what are some of their current health problems? We all know that one disease can definitely affect other organs, um, and your skin is no different than that. On the objective assessment, we really want to look throughout their whole body. And most new nurses are kind of hesitant to do this, but it's so important to actually look at their skin underneath their shirt and evaluate most of it. Look at their scalp, look at their hairs, look at the nails, look at their mucous membranes, and really do a very thorough. A very wise person once told me that if you don't look for things, you'll never find it. And that's exactly what I'm telling you to do this stuff in a very systematic and step-by-step approach. Look at the color of the skin. Are they pale? Are they sunburned? Or do they have tattoos? Look at any lesions. I am expecting you to understand how to describe lesions by medical terms. There's a uh, some wonderful pages in your book that describe this very well, and it would behoove you to know this for your exam that's coming up. When you're looking at these lesions, some of the major concerns that we have, especially as we start talking about skin cancer, would be to look at your ABCs. So A stands for asymmetry. Is it a nice round shape, or is it a kidney shape, or is it just weird looking? Look at for border irregularity. Does does it have a nice border all the way around it, or is some of it have a nice border and some of it just kind of blends into the rest of the skin, or does none of it have a nice solid border? C, look for color variation. What color is it? Is it brown? And all one color? That is far less concerning than seeing brown and black and red um, and having that all intermixed. Look at the diameter. What size is it? If it's greater than 6 millimeters, that tends to be more concerning. And then what's the history on this? Is it evolving? Is it changing? Did it start off as being something small and then gradually turn into a bigger item? So if you're noticing some of these things, this patient really should be evaluated by a provider, and often recommended that a dermatologist or a surgeon may be needed if you're worried about skin cancer. Other things to watch for these lesions, are they generalized? Is it all over the body or is it one spot? Is it down a dermatome, like a herpes zoster that could be, or shingles, I should say? Look for edema. Is it boggy? Is it edematous? Is it swollen? Any moisture with this? Is the lesion dry or is it moist? Look for any vascular changes. Is this area getting lots of blood flow, or is it becoming avascular and becoming pale? Or even worse yet, is the blood flow getting um, stopped so that it's causing the extremity or wherever you're looking to turn a bluish shade and anoxic? Look at the turgor. That's when you pinch the skin and see how fast it will go back into normal. That can be a sign of dehydration. And also look at skin temperature. Are they warm to touch? Or are they very cold because they've got poor perfusion? Are they very hot because they've got an infection? So all those things can be major markers that can help you with your patient assessment. So now we talked about that. Look at this picture and try to describe it. I'll give you a few moments before I give you some of my inclinations on this. But some of the things that's really going to help you, of course, is looking at these red spots. Is it all in one pattern? Is it linear? Is it circumferential? What aspect of the body is this on? Is it all one color? Is it shades of colors? Is it changing colors? How big are these marks? So what I'm seeing, and in this picture, it's really kind of hard to tell, but I believe that this is a leg being bent here with the kneecap. That's probably about right there. This is the calf and going down into the ankle, with the other leg being behind it. So what you're seeing are small red dots. These look flat, they're not raised above the skin. They are not orderly, they're more generalized throughout this extremity. There's no straight line or it's not circumferential around this extremity. And the other thing you can do is push on them to see if they fade away. In this case, what this looks like to me is petechiae. So we'll see what you guys came up with. Um, but to me, this looks like petechiae and a sign that there's some um, capillary fragility, and those capillaries are bursting, and so you're getting fresh blood um, trapped in the skin. So other things to look for: integrity of the skin, any skin tears. As our patient population becomes older and older, you might see that they've got skin tears. How clean is it? Do they have any marks on them? Are they dirty? Are they filthy? Is there grease on their body? Any tattoos and piercings? And if so, where are these at? The piercings can be of major concern, especially if you're doing imaging or taking a surgery or anything else that requires magnets or has potential to burn your patient. Other skin changes associated with aging would be thinning of the skin. So the skin loses its subdermal fat. And with this is why the elderly tend to be cold, is because they don't have the insulation of the fat. Also, they tend to have delayed wound healing due to devascularization. They don't have enough blood flow, and sometimes their diet is not where it should be. They tend to have skin hyperplasia where things increase in size. So you can kind of look at sometimes their ears or even their nose, and you're going to see that their cartilage is more swollen and more pronounced. They also have an increased susceptibility to irritants because their skin is a little bit thinner. So if they've got a chemical burn on them, they tend to be more sensitive to it. They may have a decreased inflammatory response. Generally speaking, right now is probably one of your highest points in your life that you'll have an increase in your inflammatory response. So that age of teenager to young adult is what I'm talking about. When you become elderly, that that inflammation tends to be decreased. And then look for mottled hyperpigmentation. Do they have any moles or nevuses that are growing? And so you can see on this arm, you've got a hyperpigmented area right here, um, just proximal to his watch or her watch. So if somebody's got darker skin tones, such as African American, African, Native American, um, so on and so forth, some of the things that you might want to look at to help you out with your assessment would be during for pallor, look at some of the mucous membranes. Are they pink? Are they well hydrated? Or is there kind of an ashy gray color? If we're looking for cyanosis, um, look at the lips, look at the tongue, look at the nail beds, look at the sclera of the eyes, look at the palms and then the soles. For inflammation, we can see that there might be excess of warmth and changes with that, maybe even a change of texture. And then for jaundice, once again, the conjunctiva of the eyes and the oral mucosa. Other things for hair would be to inspect and palpate, looking for cleanliness, distribution, quality, quantity, any dandruff, any lice, any fungal infections. This picture is a picture of hirsutism, where you got an abundance growth of facial hair. Other diagnostic things that we might do, we might take cultures, um, checking for oftentimes for fungal infection. We might do biopsies looking for skin um, cancers. And those biopsies can either be a punch biopsy, they could be slices, they can be a variety of different biopsies. And then we can look at the skin using a Woods lamp. And here is a great link for it. I'll describe it and some of the things that we can look for. This will go into more detail than what you need, but just recognize that a Woods lamp or basically using a black light is one approach to looking at the skin. So this is going to conclude this chapter. If you have any questions, please feel free to contact me.